Welcome students to our new YouTube channel Pharma Extech, the division of excellence. So this is Sunday Blockbuster series. So on this Sunday we will see the most important chapter from cardiovascular system, and this chapter is most important for GPAT aspirants and also MST CET aspirants. So the topic name is drug used to treat chronic heart failure or the drugs acting on chronic heart failure, and this chronic heart failure is also known as congestive heart failure. This congestive heart failure is the inability of the heart to pump sufficient blood to the body, and it fails to maintain the circulation of blood, and it can be caused by impaired ability of the heart muscles to contract or an increase the workload imposed on the heart, and an increase in blood volume and interstitial fluid and dilation of blood vessels occurs, and also in pulmonary congestion and edema in left heart failure, and peripheral edema in right heart failure, and it can be caused by atherosclerotic valvular hypertension and congenital heart disease as well as dilated cardiomyopathy. There is a decrease in cardiac output and an increase in venous rectum. The sympathetic system is active by increasing Ne and E, that means norepinephrine and epinephrine, to increase the heart rate and force of contraction, but the heart is a weak pump, so the stroke volume is low. And also the electrolytes present mainly in intracellular compartments are potassium, that means K+, magnesium Mg2+, and phosphates. And also the electrolytes present mainly in extracellular compartments, they are sodium Na+, chloride Cl-, calcium Ca2+, and bicarbonate, that means HCO3. The most important intrinsic compensatory mechanism in heart failure is myocardial hypertrophy. So in GPAT there is a question, which is most important intrinsic compensatory mechanism in heart failure, and the right answer is myocardial hypertrophy. So next we will see the types of congestive cardiac failure. So the first one is high output failure, in that severe anemia, thyrotoxicosis and arteriovenous shunts. And the second one is low output failure, there is decreased myocardial work capacity, in that the first is ischemic heart disease, second is myocarditis, and third one is cardiomyopathies, and fourth one is arrhythmias, and third one is increase the impedance to ventricular outflow. In that the first one is post rhythmic valvular defects, second one is hypertension, systemic or pulmonary hypertension, and third one is congenital heart diseases. So next we see the drugs of chronic heart failure. So the first one is cardiac glycosides. So first in cardiac glycosides we see the sources and glycosides. So the first glycoside is digitoxin, and the source of this digitoxin is digitalis purpurea, that means it is lip. And second one is digoxin and digitoxin, digitalis lanata, lip. And the third one is auben. The source of auben is Strophanthus gratus, seed. And the fourth one is Stropanthin K, and the source is Strophanthus combe, seed. And the last one is bufotoxin, and the source is Bufo vulgaris, toad skin. So next we see the digitalis acts by inhibiting the Na plus K plus ATPase pump, and there is action of Na plus K plus ATPase pumps in the cell. There is 3 Na plus ions out and 2 K plus ions into in the cell. So next we see the various pharmacological features of digoxin. The half-life of digoxin is 40 hours. The therapeutic plasma concentration of digoxin is 0.5 to 2, and the time of digitalization is 5 to 7 days of this digoxin. And the cardiac glycoside contraindicated in renal failure is also digoxin. This is exerted unchanged in that means this digoxin is excreted unchanged in the urine. So there is a question in GPAT, which cardiac glycoside is contraindicated in renal failure, and the right answer is digoxin. And also the cardiac glycoside contraindicated in the hepatic failure is digitoxin. So also there is GPAT in question, which cardiac glycosides contraindicated in hepatic failure, and the right answer is digitoxin. So don't confuse with digoxin and digitoxin. So the next, the toxic plasma concentration of digoxin is less than 2 nanograms per ml. And also the plasma drug concentration should be monitored in the lithium therapy, epileptic treatment, aminoglycosides, theophylline, digoxin, and antiarrhythmic treatment. So the treatment of choice in severe digoxin toxicity is Fab antibodies. So there is a question in GPAT, which is used to treatment of choice in severe digoxin toxicity, and the right answer is Fab antibodies. So next we see the digitalis induced ventricular arrhythmias is treated by, that means the drug of choice in digitalis induced ventricular arrhythmias is lignocaine. So this is also a question in GPAT, which drug is used in digitalis induced ventricular arrhythmias, and the right answer is lignocaine. So next we see the supraventricular arrhythmias, and the drug of choice in supraventricular arrhythmias is propranolol. And also in AV block, the drug used in AV block is atropine. So next we see the treatment of chronic heart failure. The therapeutic goal is the increase the cardiac output, and the drug classes used to treat chronic heart failures, in that first one is vasodilators. They are widen blood vessels and decrease the workload on heart. Second one is diuretics. These diuretics decreases the extracellular fluid volume by increasing the excretion in urine. And the third one is positive inotropic agents. These agents increases the strength of cardiac muscles concentration. And next one is positive inotropic agents. These positive inotropic agents improve the cardiac muscle contractility and by increasing the cardiac output. And also they are a family of drugs called as digitalis glycosides obtained from a plant called foxglove. And these positive inotropic agents included digitoxin and digoxin. Next we see the mode of action of this chronic heart failure. In that there is regulation of systolic calcium concentration and also the increased contractility of cardiac muscles. And they combine reversibly to the Na plus K plus ATPase in the cardiac cell membrane. It is an enzyme that uses the energy from ATPase to act as a pump. It pumps Na plus and out and K plus in. When this pump is disabled, the net result will be an increase in intracellular, not extracellular. There is increase in intracellular Na plus and K plus extracellularly. And the net influx of Na plus is due to passive movement of sodium into the cell down its concentration gradient, and the net efflux of K plus is due to the movement of K plus out of the cell down its concentration gradient. As a result, this will lead to an increase in intracellular calcium Ca plus, and thus this is due to the presence of Na plus Ca plus, that means Na plus calcium pump that normally pumps calcium out and Na plus in by detecting more extracellular than intracellular, the Na plus intracellular Na plus. So this Na plus Ca plus pump that normally pumps Ca2 plus out and Na plus in by detecting more extracellular than intracellular Na+. But when the intracellular Na+ is increased, it stops functioning and Ca+ concentration in the cell will arises. That means it rises. Since the cardiac cell experiences an increase in intracellular Ca+, there will be more Ca+ available and the systolic force of contraction will greatly increases. And the digitalis glycosides have a very low therapeutic index. There is a small difference between the therapeutically effective dose and the toxic or fatal dose. And also there is increasing the myocardial contraction, gives the decrease in, that produces the decrease in end diastolic volume, and this produces the improved ejection fraction, and this ejection fraction is the fraction of the blood contained in the ventricle at the end of diastole that is expelled during its contraction. That means the stroke volume divided by end diastolic volume. Normally this is 0.67 or it is greater than this 0.67. With the onset of congestive heart failure and ejection fraction decreases. As a result, the circulation improves, the stroke volume increases, and the sympathetic activity decreases, and also it produces the decrease in peripheral resistance, improving blood flow and the decrease in heart rate, and also the enhancing vagal tone, that means presynaptic activity, produces the slower heart rate and also slower AV node conduction velocity, and also myocardial oxygen demand is diminished. Next we see the uses. The digoxin therapy is indicated for patients with the severe left ventricular systolic dysfunctioning after beginning vasodilation and the diuretic therapy, and it is not indicated for right ventricular or diastolic dysfunction. So next we see the difference between digitoxin and digoxin. So the digitoxin, it binds to extracellular proteins, and digoxin, it doesn't bind to extracellular proteins. And also in digitoxin, the larger volume upon area of distribution, and in digoxin there is smaller area of distribution, and in digitoxin there is long half life, takes a while to be excreted, and it needs to be metabolized by the liver before excretion in the feces. That means hepatic diseases decreases by dose, and in digoxin there is a short half life, better treatment of toxic reactions like excretion in urine. And in digitoxin there is slower onset of action in digitoxin, and in digoxin there is more rapid onset of action, and this digoxin is useful in emergencies. So in GPAT there is a question, which glycoside is used in is more rapidly onset of action and it is used in emergencies? So the right answer is digoxin. And also dobutamine is also an inotropic agent. It gives intravenously in hospitals. So there is a question in GPAT that which inotropic agent which given intravenously in the hospitals, and the right answer is dobutamine. So next we see the pharmacokinetics of this chronic heart failure and inotropic agents. So all digitalis glycosides have the same pharmacological action. They differ in potency and pharmacokinetics. They are absorbed in the body after oral administration. Next we see the side effects included. Digitalis toxicity is common. Discontinue cardiac glycosides therapy. Hypokalemia or decrease serum level of potassium predispose a patient to digoxin toxicity. Determine serum potassium levels produces is low and give potassium supplements. So next we see the contraindications. In that, the first one is kidney problems eliminated by the kidneys. Second one is hypokalemia, amplified inhibition of the 3-sodium 2 potassium antiporter. And the third one is hypercalcemia, even stronger positive inotropic effects. And also beta adrenergic antagonist or verapamil, even stronger negative chronotropic and dromotropic effects. So in the contraindications like kidney problems, hypokalemia, hypercalcemia and beta adrenergic agonists like verapamil. So in this case digitalis is not used, and these are contraindications of digitalis. And also auben, this aubens is same as digoxin. So there is a question which cardiac glycoside is same as digoxin, and the right answer is auben. So next we see the dopamine hydrochloride. So this dopamine hydrochloride is a complementary drug for inotropic support, and the concentrate and it's that means dopamine hydrochloride concentrate for infusion, that means this concentrate for solution for injection, and this dopamine hydrochloride 40 mg per ml dose and 5 ml ampoule. And this dopamine hydrochlorides uses are, this dopamine hydrochloride is used in the cardiogenic shock, in myocardial infarction or cardiac surgery. Next we see the precautions of dopamine hydrochloride include the correct hypovolemic before and maintain blood volume during treatment, correct hypoxia, hypercapnia and metabolic acidosis before or at the same time as starting treatment, low dose in shock due to myocardial infarction, and also history of peripheral vascular diseases like increased risk of ischemic or of extremities, elderly. These are the precautions of dopamine hydrochloride. So next we see the dosage of this dopamine hydrochloride. In cardiogenic shock by intravenous infusion into larger vein, adults initially 2 to 5 micrograms per kg per minute, gradually increase by 5 to 10 micrograms per kg per minute accordingly to the blood pressure. And the cardiac output and urine output seriously ill patients up to 20 to 50 micrograms per kg per minutes. So next we see the adverse effects of this dopamine hydrochloride, and the adverse effects include same nausea and vomiting. These are common side effects of all the drugs of pharmacology. So the new is peripheral vasoconstriction, hypotension and dizziness, fainting, flushing, tachycardia, ectopic beats, palpitations, anginal pain, headache, dysphonia, hypertension, particularly in overdosage. These are the adverse effects of dopamine hydrochloride. So next we see the direct vasodilators. These direct vasodilators decrease the total peripheral resistance. This we see in antihypertensives. And also the vasodilators are useful in the heart failure to reduce the systemic vascular resistance. And the isosorbide dinitrate produces the mainly venous distillation which reduces the left ventricular preload, leading to a reduction in pulmonary congestion and dysphonia. So in GPAT there is a question which drug produces mainly venous dilation and that produces left ventricular preload, and the right answer is isosorbide dinitrate. This is the most important question. So the next one is hydralazine produces mainly arterial vasodilation which reduces the left ventricular afterload and increase the stroke volume and cardiac output. Isosorbide dinitrate and hydralazine can be used in combination when an AC inhibitors cannot be used. So in the GPAT there is a question that which drug in combination are used when an AC inhibitors can't used, and the right answer is the combination of isosorbide dinitrate plus hydralazine. So next we see the drugs acting on renin angiotensin aldosterone system. So these drugs decreases the blood volume, decrease the arterial vasoconstriction and decrease the hypertrophy, hyperplasia of cardiac muscles, and the drugs like enalapril. The enalapril is a representative angiotensin converting enzyme inhibitor. Various drugs can severe alternatives. Tablets enalapril 2.5 mg, and the uses of this enalapril is in heart failure with a diuretic, prevention of symptomatic heart failure, and prevention of coronary ischemic events in patients with left ventricular dysfunctioning and hypertension. Next, we see the contraindications of enalapril in hypersensitivity to ACE inhibitors, including angioedema, and also in renovascular disease, and also in pregnancy. This enalapril is contraindicated. So next, we see the precautions of enalapril, in that they are used with diuretics, hypotension with first doses, especially in patients on diuretics on a low sodium diet, on dialysis, if dehydrated, or with heart failure, or in peripheral vascular diseases or generalized atherosclerosis. There is risk of clinically silent renovascular disease, and it is used with great care in severe or symptomatic aortic stenosis, and they monitor the renal function before the and during treatment, and renal impairment reduce the dose. The liver impairment possibly increase risk of agranulocytosis in collagen vascular diseases, and the history of idiopathic or hereditary angioedema use with care or avoid in breastfeeding. So next, we see the enalapril used with diuretics, in that there is a risk of very rapid falls in blood pressure in a volume depleted patients, and the treatment should therefore be initiated with the very low doses. The high doses diuretic therapy, in that furosemide dose greater than 80 mg per daily, should be discontinued. So this high dose therapy furosemide is discontinued, or this dose significantly reduces at least 24 hours before starting enalapril. This may not be possible in heart failure, and there is risk of pulmonary edema. If high dose diuretics cannot be stopped, the medical supervision advised for at least 2 hours after administration or until blood pressure stable. So next, we see the anaphylactoid or anaphylactic reactions of enalapril, in that in this reaction avoid enalapril during dialysis with high flux polyacrylonitrile membranes and during low density lipoproteins. Apheresis with dextran sulfate also withhold before desensitization with wasp or bee venom. Next, we see the dosage of this enalapril. Heart failure, asymptomatic left ventricular dysfunctioning, and by mouth, adults initially 2.5 mg daily under a close medical supervision, and this usual maintenance dose is 20 mg daily in 1 to 2 divided doses. Next, we see the adverse effects of this enalapril includes dizziness, headache, less commonly nausea, diarrhea, hypotension. This hypotension is severe in rare cases, and also the dry cough, fatigue, asthenia, muscle cramps, rashes, and renal impairment, rarely vomiting, dyspepsia, abdominal pain, constipation, glossitis, stomatitis, ileus, and anorexia. These are the adverse effects of this enalapril. And also the pancreatitis, liver damage, chest pain, palpitations, arrhythmias, angioedema, bronchospasma, rhinorrhea, sore throat, pulmonary infiltrates, paresthesia, vertigo, nervousness, depression, confusion, drowsiness or insomnia, pruritus, urticaria, alopecia, sweating, flushing, impotence, Stevens-Johnson syndrome. So in GPAT there is a question, which drugs adverse effect is Stevens-Johnson syndrome, and the right answer is enalapril. And also the toxic epidermal necrolysis, exfoliative dermatitis, pemphigus, taste disturbance, tinnitus, blood vision, electrolyte disturbances and hypersensitivity like reactions. These hypersensitivity like reactions including fever, myalgia, arthralgia, eosinophilia and photosensitivity, they are reported. So the next are used, they are diuretics, and in diuretics the first one is hydrochlorothiazide. This hydrochlorothiazide is a representative thiazide diuretic in various drugs, can serve as alternatives. Next we see the uses of this hydrochlorothiazide in heart failure and hypertension and edema. Next we see the contraindications of this hydrochlorothiazide. The contraindications included in severe renal or severe hepatic impairment, hyponatremia, hypercalcemia, refractory hypokalemia, symptomatic hyperuricemia and Addison's disease. So this hydrochlorothiazide not used in Addison's disease, hyperuricemia, hypercalcemia, refractory hypokalemia, hypoatremia and hepatic impairment. So next we see the precautions of this hydrochlorothiazide. The precautions like renal and hepatic impairment, appendices 4 and 5, and pregnancy and breastfeeding, elderly reduced dose may cause hypokalemia, may aggravate diabetes mellitus and gout, may exacerbate systemic lupus erythematosus polyphyria, dosage heart failure by mouth, adults initially 25 mg daily on rising, increasing to 50 mg daily if necessary, elderly initially 12.5 mg daily, adverse effects, fluid and electrolyte imbalance leading to dry mouth, thirst, gastrointestinal disturbances including nausea, vomiting and weakness, lethargy, drowsiness, seizures, headache, muscle pains and cramps, hypotension including postural hypertension, oliguria, arrhythmias, hypokalemia, hypomagnesemia, hyponatremia, hypochloremia, alkalosis, hypercalciuria, hypercalciuria, hyperglycemia, hyperuricemia, gout, rashes, photosensitivity, altered plasma lipid concentration, rarely impotence, reversible, blood disorders including neutropenia, thrombocytopenia, pancreatitis, intrahepatic cholestasis, acute renal failure, hypersensitivity reactions like pneumonitis, pulmonary edema, severe skin reactions. Then next we see the other drugs used in cardiac failure. They are amrinone, milrinone. And last we see the drug which inhibits the phosphodiesterase enzyme PDE. They are methyl xanthines, bipyridines, that are amrinones, milrinone, PDE3 inhibitors, amrinone, milrinone, vesnarinone, and PDE4 inhibitors, drotavirin, piclamilast, and the PDE5 inhibitors like sildenafil. That means sildenafil. So at last we see the classification of cardiac glycosides and chronic heart failure. In that, first one is cardiac glycosides and the examples are digoxin, digitoxin and aubane. And the second one is positive inotropic digitalis substitutes and the example is dobutamine. And the third one is phosphodiesterase, that means PDE inhibitors, and the examples of these phosphodiesterase inhibitors are amrinone, milrinone and theophylline. And the fourth one is AC inhibitors like captopril, enalapril and lisinopril. So all the prils are AC inhibitors. And the fifth one is diuretics and the examples are furosemide and hydrochlorothiazide. And the last one is vasodilators and the examples are nitroprusside, nitroglycerin, hydralazine, isosorbide and theophylline. In this way, there is end of this chapter, drug used in cardiac heart failure. That means chronic heart failure. So in this we see the some basic information about chronic heart failure and the adverse effect of various drugs and classification of drugs of chronic heart failure, then cardiac glycosides, mode of action of these cardiac glycosides. These are most important in GPAT. So this is more more important chapter in GPAT and CET exams. So hope you like this video. Please, if you like this video, please comment on comment section, and please share this video more and more to your GPAT aspirants as well as CET aspirants, and also like, share and subscribe to our channel. And thanks for watching this video. Thank you for watching. Stay tuned with Pharma Extract. Thank you for watching. Stay connected with Pharma Extract. Stay tuned. Thank you. Welcome students to our YouTube channel Pharma Extract, the division of excellence. So